takes a minute to queue up. Good evening. Welcome to this month's Facebook Live. This evening we have John Smith, Chief Financial Officer for Memorial Hospital of Carbon County, Nancy Tanner, Business Office Manager, and Emily Weber, Business Office Supervisor, here to provide helpful information about the overall billing and insurance claims process, as well as highlight some of the many changes that we have been making at MHCC in this particular area. This is a very detailed topic, and our intent is to provide an overview only. We plan to offer future sessions to explore other related topics as well. Please keep in mind that due to HIPAA, we cannot discuss any specific patient bills or insurance claims. We invite you to contact the MHCC billing office to have one of our specialists look into your account privately. As always, questions are welcome and they will be addressed at the end of the session. With that, we'll go ahead and turn it over to John Smith to get us started.
Great. Thank you, Stephanie, and thank you to the Rollins Higher Education Center here. We really appreciate the forum and the opportunity to speak to our Carbon County residents and others outside those borders joining us. As Stephanie did point out, this is a very large topic, and any one section of it could be its own hour-long program in and of itself. But we know that just like many things in life, working in healthcare, that people's health and the money that they expend on their health are very sensitive topics. And so as such, we feel like it's important that we start and provide some education to our local community, as well as answer questions and make ourselves available, not just tonight, but further moving forward to answer any questions and try to help people to gain a greater understanding of what we do and what we provide. So, as Stephanie mentioned, I'm going to provide just an overview of a couple of changes that we've made really over the last couple of years at MHCC. Going back several years, the facility made some decisions on outsourcing certain aspects of our overall billing and coding program. That does create some challenges internally as well as externally, but in doing so, what we were looking for, one of the things we've been looked for was a partner that really understood us here in Rollins, as well as critical access hospitals, which that's a term that we could do a whole session on as well, but just know that locally we're known as a critical access hospital, and there's certain and special billing requirements that go along with that. So as part of that, we had partnered with a firm for many years handling our billing and coding, and a couple of years ago we went through a very exhaustive process of evaluating that partner and felt like we needed to make a change for really the betterment of our organization and the betterment of our overall patient experience with regards to billing, which really is part of the patient experience. So that's a change that we did make, and went with a national firm that I'd worked with many years in the past that really understands the small rural hospitals and the challenges that we face and the type of billing that we need to be doing for our community. So that's really a very positive change that we've made over the last couple of years. Also, during that same time, we sat down and reviewed our overall charges. We hear on a regular basis about how how much people are charged for certain services, and I'd be the first to admit that services in healthcare cost a lot. There are many reasons why those costs are what they are, but what we really strive to do is to try to provide a fair price for the best possible services we can provide. So we partnered with a different national firm to really review our charges for services, all of our services, compared to all the hospitals in our service area, not just hospitals on the West Coast or the East Coast, but hospitals in Rock Springs and hospitals in Douglas and Cheyenne and Laramie. And as such, we really made a number of changes to our rates over time, which allows me to tell folks that truthfully, we really, our charges are right in line and oftentimes below the average of what those other facilities are charging. Now, that doesn't mean that there aren't specific items or line items that there might not be questions on, and I would always encourage folks, if they have questions, if they've had services elsewhere, and they're willing to share any details with us, we're certainly willing to sit down and talk to people about what our charges include, so that we're looking at apples to apples comparisons, as well as ensuring that if an error is made, we fix that error and correct that for our patients, not just now, but moving forward. Additionally, when I first came here, we would send out a billing statement to every patient for every single encounter as soon as they had that visit. That's great information for a lot of people, but it also can become quite overwhelming if you have a number of people in your family, as I do, and a number of different visits, unfortunately, as I do as well. And so we made some modifications to our statement process, so that one, only we send statements out based upon what's called a guarantor. So a guarantor might be in a household, might be a mom or dad, and then their children are billed underneath them, so you can get multiple people, all the people under one bill. So for instance, in my family, my wife and I are both individual guarantors, but our kids, the bills come underneath one of the two of us, so that they're all coming together versus us getting multiple different statements for everybody. A second change that we made was we only send statements out to people when the bill becomes their responsibility. So that means if we build insurance and we're waiting for 6 months for insurance to process, which happens at times, you as a patient will not get a statement until that bill becomes your responsibility. So that's an important change, because a lot of times we can provide information to people at any time if they call and ask us, but we just tried to kind of make it easier for people to understand what they were getting versus getting bills that said this is not a bill, it's for information, but then receiving bills as well, and what they should or shouldn't pay. People were confused at that, so we tried to simplify that process a bit over the last couple of years as well. We've also made some major changes, and Emily will talk a little bit about some of the changes we've made in our upfront processes. But one of them is in going to our clinics asking for copays. While that, people don't always have money available, people oftentimes have copays due for their clinic services, and our staff over time has really, we've trained and worked with them considerably to be more comfortable in talking to people about financial expectations and asking for their $20 copay for a clinic visit, or $30 copay. Additionally, we now, if somebody has a scheduled procedure at the hospital, we not only contact them from a clinical perspective and talk to the patients, as we have for many years, about what they can and can't expect and should and shouldn't expect, and what they should prepare prior to coming to the facility for their procedure, but also we make phone calls to those same folks to discuss financial expectations as well. Really, a lot of people don't think about it, but the finance side and paying bills is as important and as big a part of the healing process for many of us as the service is oftentimes. So again, Emily will talk a little bit more about that, but we do try to make sure that people are aware of what some of those costs are going to be for them up front, and try to involve them as early on in the process versus waiting until the very end and then springing a large bill on people. We've also just launched today a new program for extended payment plan options. So now at the facility, what we're going to have available is a payment in full option with a discount for folks based upon how much that your individual percentage owing. Also up to 6 months internally with a minimum payment in there, but the payments can't last longer than 6 months. Or a third option, we've partnered with both locally and nationally with groups to help us extend payment plans, which allow for as low as $40 a month payments and as many as 5 years, as long as 5 years or 60 months to pay those bills. So really trying to provide options for people, because we understand that services, and even with good insurance, oftentimes the amount that we owe can be large, and so we want to try to help people and provide options. At the same time, the hospital is not equipped to manage long-term payment plans like, say, a bank is, and so that's what we've done, is partnered with a bank to be able to provide those services. The last couple of items, our last main item, just over the years, many people probably recognize that at Memorial Hospital, Carbon County, and all of our clinics, we've operated multiple different systems, which leads to multiple bills that look very different from one another, multiple records, multiple patient portals with information on them, and sometimes that creates a great amount of confusion and concern for people. It does the same for us from a staffing perspective, believe it or not, as well. So recognizing this, we went through a very exhaustive process this last spring, and evaluated multiple different hospital software programs that were all inclusive, that had both the hospital and clinic products available, and billings all inclusive, records all inclusive in that. And as part of that process, the staff actually, really let the staff lead the decision on this. And it was a unanimous, or close to unanimous, decision to partner with Cerner Community Works, which is a product that was built for small facilities like ours, but it's all inclusive. And so you'll be moving forward, we're just starting the conversion process now, but at this time next year, we'll be able to provide bills, one bill for clinic and hospital services on a combined format. As well as allow for one patient portal for folks to be able to log in and get their information, or pay their bill in one place versus multiple locations, set up one payment plan. So that's exciting. It's not only exciting, I think, for our community, but it's very exciting for our staff as well, because it gives them more tools to be able to utilize to improve the services they're providing to our community. So again, that's a very brief overview, but wanted to share that we hear our community. We know that there's always questions about billing. It's a challenging topic, and it's a sensitive topic. And so not only tonight, but moving forward, we're here, and we're happy to try to talk individually with people after this session about their specific circumstances. So thank you very much.
So as John said, I'm going to go over a little bit about the process that happens as soon as you walk in the door at MHCC. Once you've had that clinic visit, your physician decides that you need further evaluation, MRI, lab, things like that. We're going to go over that process. So the good majority of our outpatient services at the hospital require an appointment. So once your doctor provides you or MHCC with the order for items such as lab, imaging, or surgical procedures, you'll call to schedule the appointment. At that time, our radiology department or surgical department will let you know if that procedure is high cost and requires what we call a prior authorization. If the appointment requires a prior authorization, we will contact your ordering physician to obtain clinical documentation that we submit to your insurance company, and then what they will do is review all of that documentation to decide if the testing that was ordered is medically necessary. So there is a process for that. We'll reach out to your ordering physician to obtain those clinicals, but we cannot submit that prior authorization without that documentation. Once we submit the prior authorization, the process takes anywhere from 7 to 14 business days. Some of the items don't require one, so sometimes you can be seen as soon as next day. While we're on the phone obtaining the prior authorization, we also ask for eligibility information, deductible, and co-insurance. These items are super important for you to know for your personal benefit. Knowing how much your deductible is, knowing what your co-insurance is, so you have a good idea of what's going to be expected for you to pay upfront. As John said, we are working on collecting upfront for those higher cost procedures. So if you come into MHCC for a surgery or a MRI or CT scan, we're going to be asking you to pay that deductible upfront. So if it's your first service in your calendar year for your insurance, you have a $500 deductible, you're going to be expected to pay that $500 up front to have that MRI or that surgical procedure. So knowing what your deductible is ahead of time is very helpful for you, so you know what to expect. When you come in for your date of service, it's very big that you arrive at least 15 minutes ahead of time so we can have an accurate registration process. The information that you give to the registration clerk is the most important part of our billing process. We're going to ask you for particular items such as your billing address, your current phone number. Whatever you provide to us at that time is where your bills are going to go, or if we're having issues with your insurance, we're going to call that number. So that information is the most important piece of information outside of your insurance policy that we're going to collect from you. So once we do that, we're also going to ask at the time of registration, if you haven't made that upfront payment, we're going to ask for that. If you can't afford it, we as John said, we have those payment options. There are minimum down payments as well for self-pay. So if you come into MHCC, you have an order for an MRI, you won't go through the prior authorization process, but you will go through a self-pay process. So we'll be asking you to pay for the procedure upfront in full with a self-pay discount. If that's not obtainable for you, we do have a minimum down payment option. And if that's not obtainable, then we do ask that you speak with our financial counselor that we have on site. We do have a financial assistance program based on household income, and it is approved in percentages, 10% to 100%. Based on household income. Anyone over the age of 18 in your household, we do ask for their income information for that application process, and we review each application on an individual basis. And outside of that, we have our new lending program that John discussed. And then once you're registered for your procedure, you'll get your wristband with your information. We ask that you verify that information, so you're double checking us, making sure we're doing what's expected of us, and you'll be sent to your department for those individual services. I'm going to have Nancy discuss what happens after those services are rendered as far as the insurance billing process.
So you've had your services, now what? You're going to, we hold our bills in waiting for 5 days, letting our department managers and whoever does, some of our department managers enter their own charges. Sometimes it's done in a different department. So there's 5 days that we hold the bill, waiting for all your charges to be added so that we can send your claim off to your insurance. So after that 5-day bill hold, then we send them to our coders who code your bill according to how your doctor wrote your order. So we have ICD-10 codes that go on them, and our coders look at the ICD-10 code to make sure that and so they can code it correctly so that we have a smoother process through the submission. So then when the final bill is ready, when the bill is finalized, so after the coders finish it, then the bill is finalized, then it comes to us and we submit the electronic claim. So we run a file, and then we submit it to our clearinghouse, which actually scrubs the claims, and will sometimes it will hold it in there so we can work it for some kind of edit or something, so we can go in and fix it, and so that we can ensure that the claim is going out as clean as possible for whatever edit it's showing. And so then after the billings, after it goes into the clearinghouse and they fix the claim if it needs to be, or just go ahead and push it on out, then it goes electronically to your insurance company. If your insurance company does not accept electronic claims, we will send paper claims to them, which takes a little bit longer, of course, because it's not electronic. So we monitor your claim for any errors and make sure that the claims go through smooth. And sometimes it can take anywhere from 15 to 45 days for, once it gets to your insurance company, for them to then give us a payment on your claim. So it depends upon what insurance company it is. Some of them are quick payers and some of them are not. So, and sometimes it may get to the insurance company and it's a high cost bill, or it's been a longer stay, they may require some medical records. So then we have to request those, and then we can resubmit those. So sometimes it can take a while for your claim to process. It just depends upon, you know, what you were there for. So, so like I said, the insurance companies we can get a payment sometimes 15 days after your your claim has been submitted, and sometimes it takes up to 45 or sometimes even 60 days. So then once we receive the payment, we're gonna post it to your account, and then if you have a secondary insurance, it's then gonna go out to the secondary insurance, and then depending upon how quick they pay, then we have to wait for it to clear that secondary insurance. So, like John said, we're not going to send you a statement until the balance is your responsibility. So, if you don't have a secondary insurance, you'll get a statement a few days after the payments post onto your account from your primary insurance. If you have a secondary insurance, you'll get a claim shortly after those payments have been posted, and the balance becomes patient responsibility. So, and then after that, your statement will come, and it'll list your insurance payments, and you can compare that with your explanation of benefits that you've probably already received, and it'll have your balance. So, and that's where if you don't agree with your balance and you don't think it's correct, that's when you need to give us a call so that we can help you through that process. Sometimes it can be a difficult process for people if they don't really know what their insurance benefits are or how much they should owe. So we're more than happy to help you. We always have copies of your explanation of benefits. So if you can't find them, you don't think that you received them, just make an appointment, come in, and we'll print it all up for you and explain the whole process. So that's kind of how the claims work.
Great. All right, so at this point, we'll go ahead and move into some questions. My first question is probably something that pertains to you all as a group. What are some of the most common questions you receive from patients?
If you want me to go, or if you want to go, I will.
Go ahead.
So I think one of the things that comes up quite often is that patients feel like, I have insurance, so I shouldn't know anything. And to my knowledge, there are very few insurances, if any insurances out there, that pay claims in full and don't leave a responsibility. Oftentimes, even with Medicaid and Medicare, which that's where we see a lot of the confusion, I would say. There are deductibles, even very small deductibles. Medicaid for clinic visits, it's as low as $2, $3, right in that range. Medicare's annual deductible is $203. And so even though you may have a co-insurance amount, which might be 20% of the amount owed or 10% of the amount owed, you have that deductible, but that is a very frequent statement. And I think a lot of times it creates confusion because people will get a bill and feel like, oh, well, it still must be out to my insurance. And so to Nancy's point, if you do receive a statement in our facility, other facilities may handle that differently, and I've been in other facilities where we handled it differently. We just felt like, to help our community better understand, we felt like only sending out a statement once insurance that we have on file has processed. If you receive a statement, from our perspective, we're saying that that's a bill that you owe. So if you do have questions about that, do please reach out to us, because it may be that you have a secondary insurance, or maybe the co-insurance is different. We take what information is sent to us by your insurance company. We also take what insurance is posted on their websites oftentimes as well. And we know that unfortunately not everything on the internet's true, and the same holds true when it comes to insurance sites as well. So I know that's one of the very common questions or things that we get.
Yeah. I think the only other one that I can think of that's come up quite frequently lately is, that was my annual mammogram. Why wasn't it covered at 100%? That was my annual colonoscopy. Why wasn't it paid at 100%? While it is true that most insurances cover those items once a year at 100% as long as they remain a screening, they're no longer a screening when they find a lump in that mammogram. They're no longer a screening when they remove a polyp in that colonoscopy. So once those diagnostic things happen, it is no longer a screening. It's coded differently because something was found, and it does apply towards your deductible and coinsurance. So you may reach out to your insurance and they'll say it was coded incorrectly. Reach out to us, we will review it, but 9 times out of 10, it was coded correctly. It's just that you weren't in the understanding that once something is found, it's no longer a screening and it will be coded as diagnostic instead of a screening.
And again, on that same question, if there's something that comes to mind throughout the remainder of the session, we can certainly revisit that. What are some reasons that insurance might deny a service/claim?
A big one that we're seeing is not medically necessary. If we can't get that clinical documentation from your ordering provider, we submit it with what information we do have, and the insurance company actually has doctors on site that review those claims as well. And if we don't submit enough documentation to deem it medically necessary, they're going to deny. So what happens if you have an emergency, we're checking you for appendicitis. They're gonna order that as what we call a STAT procedure. You're gonna come in, you're gonna currently bypass the prior authorization process and be seen that day. But that doesn't mean that that prior authorization process doesn't still happen. So we're reaching out to your primary care physician that ordered that CT scan to obtain those documentations. And if we can't get in touch with them or they're not sending them over to us, we submit for the prior authorization, but without those clinicals, they're not going to deem it medically necessary. So in those cases, when that happens, we may reach out to you as the patient and say, you know, we've been trying to reach Dr. XYZ to obtain your clinical information for your prior authorization. We haven't been able to obtain those yet. You know, we would suggest that you as the patient reach out to your primary care physician and help us obtain those documentations.
Well, that's good, right?
Okay. All right, great, thank you. Can you explain, when does a bill go to collections? What does that process look like?
So it's just nobody likes to go to the collection center, and we don't like to send them to the collection center. But we send out 3 statements. We have to have at least 3 statements go out to our patients, and I like to have at least 2 phone calls, trying to touch base with the patient to you know, maybe discuss the bill further if they have questions, take a payment from them, accept a payment for with a discount paid in full. And if we've done all of those things, then when it's 120 days old and we've done our what we call our due diligence by, you know, sending statements, reaching out by phone, then we do turn it over to the collection center. So if you do get a call and they leave a message and they say they're calling to discuss your bill, you know, I think people, you know, maybe they don't want to call or they don't feel comfortable calling back, but please call us back. I mean, we've got the payment plans, we've got, you know, some discounts that you can pay in full, and we have lots of options. So, and if you don't understand your bill, then that's the time that we can explain it to you so that you understand what you're getting, what the bill is for. So,
and that goes back to the point of providing that address and that phone number at time of registration. If you move, you have to call us and update your address. If you change your phone number, you have to call us and update that information. Because if you're not getting your statement because you moved and changed addresses, we don't know that. So we see it as we're attempting to reach out to you and you're just not responding. We don't know when an address or phone number changes. So if at any time that happens, call us, ask for the business office. We can update that information in both the hospital side as well as the clinic side so you can make sure you're getting those statements. Because once it goes to the collection center, it's very hard to get it back, and there's more fees that fall onto them once they are over there that we don't have legal rights to settle.
Yeah, and I would just add to that, I think Nancy and Emily and their entire team, as well as our off-site folks, really work very hard to try to be advocates for our patients. They really see themselves as that. It definitely is in our best interest to try to work things out at the facility with patients. We are fortunate to actually have a firm here locally that provides collections in the healthcare field on a national basis. That allows us to learn some different things and benefit from a number of things, programs that they even have available to us, but it's also allowed us to build up relationships and rapport with them. And really, truthfully, it is in our best interest, as well as yours as a patient's best interest, to be able to work that out on a local basis. Even when it comes down to payments, that's part of the reason why we've set up the new payment plan program, because if somebody can't afford $500 a month for a payment, it doesn't benefit us to try to force them to pay $500. And so, we wanted to provide options for people. So as Nancy said, we will work through whatever we need to, and the staff have definitely been empowered here locally to provide, even though we do provide a lot of the services. The billing services themselves are handled outside of Rollins at this point in time. The work and the communication and that is done here locally. And so you're talking to your friends, you're talking to your neighbors, and we are here to help you in any way we can. It is sensitive. We don't like it. Those conversations are challenging for us as well. So I did want to also point out back to one of the reasons why claims are denied as well, because that it does happen quite often. One of the other things that I think happens is when we have insurance, we feel that insurance covers everything. And there are policies, even our hospital policy for our own employees, there are certain services that maybe I need, but my insurance policy does not cover. And so making sure that I as a patient know what my insurance covers, not only what's available from a deductible and copay perspective, as Emily mentioned, but talking about, does it cover chiropractic services, for instance? If I go to the chiropractor and it doesn't cover that, then that's challenging for both myself as well as the chiropractor that I'm going to, or emergency services. All plans are supposed to cover emergency services, but we do run into some oddities where some insurances feel that maybe we're out of network for those for emergent services. Most people don't plan to go to the emergency room. That's why it's called the emergency room. So there are any number of reasons why not enough documentation, or but medically necessary is one of the big ones nowadays. And we're seeing more and more services that are requiring a prior authorization, as Emily mentioned, which unfortunately just delays the process up to as long as 14 days oftentimes. And it's challenging for us on a staff perspective, because even our own departments are calling and saying, hey, how come this isn't moving? And we're calling and we're begging, borrowing, and stealing. And oftentimes the best advocate we have is our own patients, is you guys reaching out to your own insurance company and letting them know, hey, I need to have this MRI. I know the hospital's provided this information, and so we can provide the information. Many times we have to provide it multiple times because things get lost, just like they do with us, just like they do with any business. But we will continue to work to try to get those things taken care of. But I think Emily's point, just really understanding what your insurance covers is so critical. Understanding how to read the statements, I think that's another program for another time that we've talked with Stephanie about providing, and we'll definitely be doing. But just try to learn that. And if you have questions, my staff, our team is here to help you, plain and simple.
Great. So I think that's a great segue into the next question. if I'm seeking medical services, what questions should I ask to be a more informed consumer? And I think you've touched on some of those
Yeah.
points, but I think we could expand on that a bit more.
You bet. I can start there, and I think these two ladies have been consumers as well as advocates and providers on this side as well. One of the things that's unique about our facility compared to many of facilities, even in our own area, even though Wyoming is not a large state, we don't have big urban hospitals, but we do have Cheyenne, we have Casper, large facilities that we often travel to for services we don't provide here. When you come to our facility, 9 times out of 10, the services are provided to you, we bill for the physician. If you have a surgery, we bill for the anesthesia, and we bill for the whole procedure. If you have a baby, it's a one bill for all of it. Whereas oftentimes you go to other places and they provide you a quote, which we will provide you quotes as well. And that's one of the things that I want to make sure, if you want to know what something's going to cost you, being a good consumer, shopping around and asking, and no time or more like now than what we've gone through. You know, the dollar doesn't go as far as it used to, unless I guess you're buying a house these days. You know, making sure that you are educated. We want we want your services here, but what we want, if they're not going to be here, we want you to be an educated consumer and be able to ask, okay, when I'm delivering my baby, am I going to get one bill from you for everything? Or am I going to get a separate bill from the physician, another bill for anesthesia, another bill from the hospital? I know Emily talks about that in some of her trainings, where, you know, very different environment here. And many small hospitals, that is an experience that you will have. So just being able to compare apples to apples. We will provide you a quote, we'll provide you a written quote, so you can sit down and even share that information. We share our prices on our website. It's required by law, we do it. And so you can look yourself, but even more, you can call us and we'll provide you that information. So there's a couple services that we do offer that there are separate bills for. The first one is if you're admitted to the hospital, we have a hospitalist program which provides 24/7 care in the hospital, which is great, a great benefit to have from a care perspective. We bill for the hospital stay, the hospitalist bills for their own individual professional services. Also, if you see a provider at our local visiting specialist clinic, which is kitty corner from the hospital, all of those providers are coming here locally and essentially renting space from us as a provider. Many of them, or all of them, do their own professional billing. So I myself had a procedure done by one of those providers. I had a bill from Memorial Hospital, Carbon County for the surgery, and I had a bill for the surgeon cost for one of those physicians. So, but 9 times out of 10, it's an all-inclusive bill that you're getting. What other questions should people be asking?
I just think that that's probably one of the most important ones, because people always want to get the biggest bang for their buck. So they're going to go somewhere else because I was quoted $3,000 for an MRI. But you need to understand, when you're having a radiology procedure, there's a pro fee linked to that, as John said. So make sure that they're including that pro fee and that their radiologist isn't billing you separately. I myself, my daughter had surgery in Casper for her tonsils to be removed. I got 3 bills. I got an anesthesia bill, a facility fee, and a pro fee. So coming to our hospital, I would have gotten 1 bill for $8,000, say, but from Casper, I got 3 bills, one for $5,000, one for $2,000, and one for $1,000. So in reality, it cost the exact same. I just wasn't educated enough to know at the time that I should have asked what services those bills include. Also asking your doctor, you know, I'm here for my annual. This is another one that we hear all the time. I was seen for my annual, but there I'm getting a bill. Any questions that you ask your physician outside of a general annual exam is going to then push that exam out to no longer be an annual exam. If I go into Dr. Motley for my annual OB check, and then I start talking to her, Dr. Motley, I'm tired all the time. You know, can we check my thyroid levels, make sure that there's not something else going on besides my job just being super exhausting right now. That it's no longer your annual exam because you're talking about something that they wouldn't ask Nancy about. Nancy may not, her and I may go in for our annual at the same time, on the same day. And if they don't do the same thing for me that they do for her, it's really no longer an annual unless you have a diagnosis. If you're diabetic and you go in for your annual, they're gonna run an A1C for you, but they wouldn't for me. But as long as your doctor includes that diagnosis on your annual screening as a secondary diagnosis, then it will be covered at 100% because it is a true diagnosis that your insurance should already be aware of. If it's something new that they're looking for, it is not gonna be included in that annual wellness screen until it's a true diagnosis.
Well, I think these guys have really covered a lot of it, but if you have a question and you think it might be a dumb question, just ask. I mean, if you have questions and you have concerns, just, call us and ask, or when you come in at the time for your services, ask the ask the tech that's doing your exam, and if they can't answer it, we can find someone who can. So I want everybody to feel like that they're in charge of their own health care, and if they have questions, we want them to ask those, and we want to get them answers. So there's no dumb question.
Absolutely.
I'm guilty myself for not even knowing what a deductible was when I turned 18 and got my own insurance. I had no idea. I was turned over to collections because I didn't know.
Yeah.
If you truly only learn from experience, you have to ask those questions or you're just never gonna know.
And this is all of our hospital. This is not the Memorial Hospital of Rollins. This is the Memorial Hospital of Carbon County. We don't just take care of people from only Carbon County, but I can promise you, we are family here. Our facility and everybody in Carbon County here, we want your service. If you have to have services, and we understand going to the hospital or even going to the clinic typically isn't fun, but if you're going to, we want you to come here, but we want you no matter what to be educated, plain and simple, because the more, and we're looking even from a service development perspective, which is one of the areas Stephanie really works hard on with her team, looking at new opportunities that we have to bring new services to the town, or if we can't provide it in an A+ gold star capacity here, being part of that process to help you as a patient navigate the whole healthcare process, because it's confusing daily for us. There's no way it can't be for everybody else. And so we really, every time you ask a question, we learn something as well. And I can't speak for what's happened in the past, but what I can speak for is what's happening now. And we care deeply about the people in our community, and we want people to know that we are here and we want to answer the questions that they have, even if they're not questions that are popular for us to answer, even if they're concerns about costs, even if they're concerns about their care, and that we can get people to get those answers. But as Nancy said, ask that question. It's so important.
Great, thank you so much. Would you provide an overview, and again, this is a very large topic that certainly probably deserves a further session all on its own, but would you provide an overview of the pre-authorization process, and what does pre-authorization mean? That's probably the first question.
So pre-authorization, what people think it means is that insurance is going to pay, and the most important thing to know is pre-authorization is never a guaranteed payment. But it is something that we do to notify your insurance company ahead of time that there is a high cost bill that they're going to be receiving for you as a patient that applies to the contract that you have with your insurance company. So it's basically just a heads up to the insurance company. This patient has something going on that's going to cost a little bit more. We want you to have the heads up so we don't get that denial on the back end, that medical necessity denial. It's getting us it's getting the insurance company a better grasp of what's happening before it actually happens, so it doesn't delay the billing process. So we gather, like I said, we gather all of that clinical information. So you go to Dr. XYZ for the stomach pains. They think that you have appendicitis. They're gonna put in all of that documentation. They're gonna type up notes. Seen patient XYZ today, complaining of abdominal pain, we are trying to rule out appendicitis, please see them for a CT scan. They're gonna put all these chart notes in with all of your symptoms that you're having. They're gonna send the order over to us. We're gonna call the doctor's office, request that clinical documentation. Once they send it over to us, we're gonna put it with the order, with the diagnosis, with the CPT code of the test that they're requesting, and send it over to them. A lot of these are done online electronically. Our prior authorization department is really good about typically submitting these same day, as long as we can get that clinical documentation from the ordering physician. So the ordering physician sends the order to radiology, radiology scans it and sends it over to our prior authorization office. They get that order, they go out and obtain those clinicals. As soon as they obtain those clinicals, they go on to your insurance company's website, whether it's Blue Cross, Cigna, United Healthcare. We upload those clinicals with the order, and then that gives your insurance company a chance to review and see whether they think it's medically necessary. Say you fall and hurt your hand, your doctor might order an MRI. Sometimes your insurance company is gonna ask for an x-ray first. Hey, let's do an x-ray. It's a cheaper procedure, it might save us a little money. See if we can't rule out the diagnosis with an x-ray. So you might be sent to get the x-ray first, and then if they still can't figure it out with the x-ray, then they'll move forward with the MRI. It just gives your insurance company an opportunity to review, to make sure that our physicians are doing what's best for the patient, but not skipping steps in the process.
Perfect, thank you. Let's see. So, John, earlier you mentioned that the billing is currently done through an outside firm. Are there plans to bring this in-house or to change that process?
Yeah, absolutely. So as part of our process and evaluation of looking at new computer systems for the facility, one of the discussions that we had was looking into the future from a staffing perspective, from an education perspective. And one of the goals that I've had since I came here was one, to really try to improve the processes, along with the two ladies here to my right that are just second to none in what they do, and I mean that sincerely. But also look at ways and opportunities to bring more of the functions that we've historically had handled by outside groups in-house. As part of that process, and as part of our looking for the right partner to do our outside billing for us, one of the things that was really important was that, you know, when we understand they're a business as well, but in finding the firm that we did, Resolution, now owned by Quorum Health Resources, one of the great parts about their company is they see themselves as that middle point and midpoint on helping facilities like ours get back up on their feet, get things done, help us get our staff trained up, and really work themselves out of a job, which is a challenging business model to have, but it's one that they've been very successful with, and one that they've really put their money where their mouth is. And so as part of our process for converting our computer systems, what we're going to be doing, Stephanie, is we're going to be bringing on, we've already brought on a few new staff team members that we're really excited about, some folks local folks with experience, and we'll be bringing on a few others as well over the next several months. So if you have experience in hospital billing, be watching the MHCC website, mhcc.com. We will continue with the billing on the existing systems that we have with our third-party partner, Resolution. And then as we move on to the new Cerner product, as we start billing off of that, we'll have multiple systems going on at the same time. Our staff will be taking over that local billing. Again, the great part about Resolution as a partner is they're here, they have their team leader is here with us this week and has spent a great amount of time. We've had them on site here for a year, locally, not just remotely, but locally as well, local presence, which is great. But they're helping us to train up our staff, to help us get the policies and procedures and processes in place that we need to have so that we can be successful long-term. If we have that challenge, a staff member leaves because we don't have a cast of thousands, whereas other facilities do, it does create a burden for Nancy and Emily's team. So we will always be able to reach out, back out to them because we have that rapport with them to make sure that we're not missing a beat, which I think is, again, while we've partnered with third-party groups for a number of years, I think since before Nancy was here, this is really the first time that I felt like we had the right partner that understands us and wants to help us be kind of the masters of our own destiny, and we really appreciate it. I know it's been a goal of mine and of Nancy's to really bring these services back locally, because we have great people here in Rollins and in Carbon County as a whole. And so it'll be a challenge, but we're excited about this. I think is probably the best way to say it. So absolutely.
Okay, great. All right. So earlier you referenced a new system through Cerner. Does this mean that if I require an appointment at one of the clinics and then have to go to the hospital for related service, will I only receive one bill?
Absolutely. That's the most important piece that we're getting out of this, because it's not just frustrating to the patients, it's frustrating to us as well to have to look into multiple systems. So if you go to family practice clinic today and Dr. Mikesel orders you some lab work and you come over to the hospital and have that blood drawn, it's all going to be under one service date, and one bill. It's going to streamline that process and make it a lot easier and easier for the patients to understand.
Are there any exceptions to that?
I don't think so.
No.
For our on-site, for anything that is MHCC related. Now, as to John's point before, if you see visiting specialty clinic and they order you for labs, that will still be a separate bill. But as long as it's an MHCC ordering provider, even as far as Dr. Williams out in Saratoga or Carrie and Peggy Lake and Hannah, if you see them and you still drive over to Rollins to get an MRI, it's still going to be one bill.
Great, perfect. Okay, I think the last question that we have this evening is, can I still receive the 50% discount?
Nancy.
You can. You can't receive the 50% discount until the end of September. And so we are still offering it. So you have, how many days are in September? 30?
30.
Yep, so you have 29 more days to take advantage of that discount if you'd like to.
And so I'll go ahead and ask, so what was the reasoning behind that? We've had a discount in place for quite some time now. What was the reasoning for that? At this point, we're phasing that out. Why is that?
Well, I think, I guess, we started it and, kind of around the first of the year, and we thought, well, we'll end it during tax time, and it kind of went over well. So we kept doing it, and people seem to be receptive of it, and call and ask for the discount, and now it's kind of not a whole lot of people, I guess, are taking advantage of it. So we've decided to just go back to our regular pay in full discount.
So can you describe that a little bit? Paying in full discounts, what does that look like?
So after the end of September, if you would like to call and pay your bill in full, we'll be offering a 25% discount. And if you have insurance, we bill your insurance first, of course, and then after you receive your statement, within the first billing cycle, which is once you receive your bill for, you have 30 days to then come in and take advantage of that discount. If you don't have insurance, we are offering a 25% self-pay discount up front, and then you can also in addition take the other 25% to pay it in full. So a lot of times it takes a little while to get all your charges on and everything. So once you get a final bill, then you can, within that 30 days, you can call and take advantage of those discounts. So that's what it'll be after the end of September.
Okay, perfect. So again, at this point, we don't have any other questions coming in. Any final thoughts from you as a group?
I'd be happy to. I'll kind of end it here. Once again, I just want to thank the Higher Education Center here for being a great host. Want to also thank the MHCC marketing department for helping to bring us here. We know that, again, people's health care and the costs associated with it are a very touchy subject, a very important subject, and oftentimes, you know, people's ability to heal is impacted honestly as much by how much the bill is going to be as the care they receive. And so what we want to make sure and do, while we may not be able to take all that burden away, we really want to be your advocate, and we have a number of programs available and options available, I think more than what most facilities do, to try to provide you with options so that you can focus less on the cost and more on healing and you know, hopefully not having to come to the hospital, not having to have those medical incidents. As much as that keeps us in business, we really want to be here as a resource for folks in the community, versus having to be here because, you know, people are getting sick all the time and that. And so again, I think we're going to take this as an opportunity to expand moving forward on a regular basis here, hopefully at the Higher Education Center, on other programs and other topics in this same realm, because it probably is one of the most confusing parts of healthcare in general. And I've thought long and hard about any other industry that bills for services and tried to find one that is more complex and more complicated. And I really struggled to find that. And so the fact that we have questions every single day, please don't hesitate, as Nancy said, to ask your questions. Know that we're here for you. We care for you. We love everybody here in Carbon County, and we just appreciate the time in the audience. Thank you.
All right, thank you everyone for joining us this evening. Again, if you think of a question that was not addressed during the live session, certainly feel free to send that through the MHCC Facebook page, and that question will be shared with the appropriate personnel, and we'll make sure to get an answer back to you as soon as possible. Thank you again, and have a great evening.